In this section, I'm going to give an overview of brain stimulation therapies available to those with major depression, specifically electroconvulsive shock therapy, or ECT, and transcranial magnetic stimulation, or TMS. These treatments involve stimulation of the brain and are far less common than the other treatments we've reviewed. They are used with people with very severe depression who have not responded to other treatments. Let's start with ECT, which is a procedure used to treat very severe or life-threatening depression. It's used when other treatments, such as psychotherapy and antidepressant medications, have not worked. Electrical currents are briefly sent to the brain through electrodes placed on the head, producing a short seizure. It's believed this brain stimulation helps relieve symptoms of depression by altering brain chemicals, including neurotransmitters like serotonin and natural pain relievers called endorphins. ECT treatments are usually done 2 to 3 times a week for 2 to 3 weeks, and then it tapers down to about once a week and then to about once a month, and this can continue for several months to a year. Patients are given a sedative before the treatment, and they often don't remember the treatment itself. ECT is a highly effective and safe treatment for those with severe depression and can often be life-saving, especially with individuals who are very suicidal. Let's talk about transcranial magnetic stimulation next. TMS, a newer treatment in ECT, might be an option for people with severe depression who do not respond to medications or cannot tolerate their side effects. TMS involves using a magnet to activate the brain. An electromagnetic coil is put against the forehead, and short electromagnetic pulses are administered through the coil. This feels like tapping and is generally not painful. A typical TMS session lasts 30 to 60 minutes, and anesthesia is not needed. Patients receive treatment about 5 days a week for 4 to 6 weeks. A course of TMS treatment can be quite expensive. Although it is FDA approved for treatment of depression, the research on its effectiveness has been mixed. That wraps up our discussion of brain stimulation therapies for major depressive disorder. Join me next time to talk about how family members can help their relative with the disorder.